Chronic fatigue and hypothyroidism often go hand in hand, and it's important to realize that when we're talking about chronic fatigue, it really exists as a spectrum, and it varies greatly from one person to the next. On one end, you have people who just have this mild fatigue. They can still push through the day. However, on the other spectrum, you have people that are literally just run down. They're exhausted, they're wiped out. And this is the kind of fatigue that really impacts you from doing the things that you love, going places that you like to go to. It's the kind of fatigue that you schedule your life and your events around your energy. You don't go out, you don't see your friends anymore because you're exhausted all the time. If you're a parent, mom or dad, you find yourself not wanting, I dare say, hang out or do things with your kids because you're so tired. You're so exhausted all the time. You'd rather sleep than go for a bike ride with your kids. And so these are some of the severe cases. And in some cases, worst case possible scenario, you become housebound and you become bedridden. Well, if that's happening to you and you struggle with this debilitating fatigue, this brain fog, and even chronic pain, you're going to want to check out today's video. All right, I'm Dr. Hagmeyer, and I want to welcome you to my YouTube channel. If this is your first time, I'm glad you're here. I'm the clinic director here at drhagmeyer.com, where we help patients from around the world find answers and find solutions to their thyroid problems, to their chronic fatigue syndrome. And we do this using the principles of functional and lifestyle medicine. Our motto is, you can't fix something if you don't know what's causing it. Now, perhaps your doctor, you went to your doctor complaining of this chronic fatigue, and so your doctor was suspicious of potentially a thyroid issue, and so after testing your TSH levels, which is one of the thyroid markers that's used to screen your thyroid, maybe they ran a TSH test, and maybe your doctor even ran a free T4 test on you. However, when your doctor got these tests back and they called you, they told you that, hey, all these tests are normal. There's nothing wrong with your thyroid. And so that's kind of what we're going to talk about today. If your TSH level was normal and your T4 levels were normal and you suffer with chronic fatigue, does that mean that you don't have a thyroid problem? Or that the thyroid is not really a culprit to this debilitating chronic fatigue that you are experiencing? And I would say absolutely not by a long shot. And that's what I want to talk to you about today. What you might not know is that your chronic fatigue and your symptoms of brain fog and chronic pain and anxiety and depression, they're all related to your thyroid function, but more specifically, they are related to a unique pattern of thyroid markers that don't normally show up on a routine thyroid test, or what I refer to as a really bad screening, which is what most doctors actually test. You see, when it comes to chronic fatigue that's caused by thyroid problems, it's so important to be evaluated for your non-typical thyroid markers, right? And I'm talking about your thyroid markers like T3, free T3, and reverse T3. These three markers become so very important if you're struggling with chronic fatigue and your doctor has told you that your thyroid levels are normal. But again, unfortunately, for many people that do suffer with chronic fatigue, most physicians don't test, or worse, they won't test their patients' T3 levels or free T3 levels or even their reverse T3 levels. And when you ask them for these tests, they'll tell you that these tests are useless or they're outdated or they don't really mean anything. And if this sounds familiar to you, I believe this is a huge mistake for a subgroup of patients who do suffer with chronic fatigue syndrome and thyroid problems. And what I really think what happens most of the time when your doctor tells you those things is that they're really trying to tell you that they're stuck in a 1950s mindset of thyroid replacement. And so if all your doctor's going to do as it relates to managing your thyroid is prescribe thyroid replacement, then yeah, that Synthroid or the levothyroxine, if your TSH levels are normal, they're not going to do anything else. So there's several inherent problems with this, and we're going to talk about that. But I think the other issue that comes into play here is that a lot of times your doctors really just don't know how to interpret or know what to do with results other than TSH and T4. And so that's, again, a big reason why they don't run the T3 or the free T3 or the reverse T3. So again, what do we do with these results of these tests when you have them? Well, that's what we're going to get into and talk about today. Why is T3 thyroid hormone? Why is free T3 thyroid hormone? Why are these so important when you experience chronic fatigue, right? So the important thing to realize about T3 thyroid hormone is this is the active hormone, right? This is the active hormone produced not only by your thyroid gland, but It's also produced by your liver, it's produced by your gut, and it's produced in your brain. So it's these T3 levels that really determine your body's metabolism, how your body burns calories, or maybe how it stores calories. It's your T3 levels that can speed up your heart rate or slow down your heart rate. It's your T3 levels that affect your body's mitochondria. And it's your mitochondria that are responsible for generating energy in the cells of your body. Now, if your cells don't make energy, if they don't make ATP, you walk around feeling and thinking like a zombie. You have no energy to do anything. And this is how low T3 and low free T3 cause so many health problems. And this is why I believe that measuring both the total T3 and your free T3 are some of the most important thyroid markers that could be run for someone who struggles with chronic fatigue syndrome and brain fog. You see, once we know a patient has low T3 or free T3, also called low T3 syndrome, now what we do is we need to find out what are the reasons, what's the cause for the low T3. So the investigation is not over just because we found low T3 and you suffer with brain fog and fatigue. The investigation now is just beginning. Now we have to understand why. Now, if you're still with me and you're finding value in this video, give this video a thumbs up. If you like it, subscribe to my channel. This helps me know that the time, the energy that I put into these videos isn't a waste of my time and my energy. And if you like the content and you want to receive notifications of when I post new videos, be sure to hit the notification button, okay? So you may be wondering the difference between total T3 and free T3. What's the difference between the two? Well, when we say total T3 thyroid levels, what we're really saying is that this number represents the total amount of active thyroid hormones in your blood. And this includes the thyroid hormones that are bound to proteins and the thyroid hormones that are not bound to proteins. The free T3, this represents the amount of T3 that is actually available to be used for the cells of the body. So your T3 represents how much you have in the bank, and your free T3, this is how much you can withdraw. All right, that's how I like to think about it. And the other thing I would say is, which one do you think is more important to measure these days when we're talking about thyroid hormones? Is it important to put all our energy and emphasis on the non-active form of thyroid hormone, which is your T4 levels? Or does it make more sense to look at what's available in the body and what is the active component of thyroid hormones? And the answer should be, and what you should be thinking is, why isn't my doctor checking and evaluating my T3 levels, right? Because most doctors, the fact of the matter is, most doctors never bother to measure the active hormones. What they often do is they measure your T4, maybe they measure your free T4, but again, these are the inactive thyroid hormones in the body. The body still needs to convert that T4, it still needs to convert it into T3. So, like I mentioned just a moment ago, identifying the low T3 or low free T3 really is only half of the equation. And this is again where, I hate to say this, but this is where most doctors mess everything up. If they're smart enough to even measure T3 or free T3, they often make the big mistake now of just simply playing the replacement game. And really, to be quite honestly, this is no different than the doctor who just simply prescribes Thyroid or levothyroxine because the patient has low T4 levels, all right? Taking T3 because your T3 levels are low, this still does not address the cause of the low T3 in the first place. And so there are many reasons that T3 and free T3 can be low. And I understand that on a superficial level, it might seem very logical to just take T3 because your levels are low. But again, we always need to think root cause, right? Remember, T3 is the active thyroid hormone, and it's 4 times more potent than T4. So if you're taking the active thyroid hormone, it's very easy to get overdosed and, of course, end up in a hyperthyroid state. What's been your experience, right? Have you taken T3, Armour, or Cytomel? Have you ever experienced these hyperthyroid symptoms? Have you been overdosed, right? If you have, drop me a comment in the section below. I want to know what your experience has been. So here's a few things that are worth looking into that are not only causing low T3, but of course, contributing to your chronic fatigue syndrome. So number one is inflammation, right? Inflammation can prevent your body from converting T4 into T3. So again, the inactive T4 thyroid hormone into the active thyroid hormone, which is T3. Inflammation does that. Number two is autoantibody reactions. This is where your immune system begins to attack certain neurotransmitters or neurotransmitter receptors in the nerve system. This can certainly cause chronic fatigue syndrome. The third thing I often think about with my patients with chronic fatigue syndrome are things like infections and also things like vaccinations. Many times people have adverse reactions to vaccines, and they're not the acute reaction to a vaccine. Their reactions to these vaccines take place many, many months later or sometimes even years later. So again, infections can be also a component to that. Number four that I think about when it comes to chronic fatigue syndrome, as it relates to thyroid disease as well, is perhaps a leaky gut, right? People who have a leaky gut can have bacteria that release these toxins called LPS, lipopolysaccharide toxins. And these toxins cause and elicit a very, very strong immune system reaction within our bodies. So they drive inflammation, they drive up your cortisol levels, they affect your liver, they affect your brain, and they, of course, they're also going to impact T4 to T3. So there can be multiple reasons why your thyroid levels come back normal if your doctor's only testing TSH and T4. This is why it becomes so important to look at some of the other non-typical thyroid markers, okay? So the fifth thing that I think about in patients with chronic fatigue syndrome is gut dysbiosis, right? Anytime we have an unbalanced microbiome, maybe it's caused by diet, a diet that's high in sugar, maybe it's a diet that's too restrictive, maybe a person's taking medications like they've been on the pill or some sort of hormone replacement therapy. Maybe they've been on antidepressants. Maybe they've been on antibiotics. Sometimes even taking the wrong kind of probiotic can cause gut dysbiosis. In fact, I just had a patient earlier this morning email me. He's in terrible shape and he's been taking probiotics and now he's worse than ever. So you have to be careful in some circumstances like this. But again, all of these things play an important role in thyroid health, okay? The sixth thing I think about is like small intestinal bacterial overgrowth. So before, when we were talking about dysbiosis, we were talking about it in the large intestines, but a person can certainly have a problem in their small intestines where the bacteria that are in the large intestines, they migrate up into the small intestines where they don't belong. And that can cause things like bloating, it can cause acid reflux, it can cause constipation, some people it causes diarrhea. But again, that's something called small intestinal bacterial overgrowth or SIBO. The seventh thing that I think about, number 7 that I think about when it comes to fatigue is I think about high levels or even low levels of cortisol. Now, cortisol, this is a hormone that's made by your adrenal glands. It's released in times of stress. And of course, high levels or low levels can not only affect the production of thyroid hormone, it can also cause thyroid receptor resistance, and it can also impact, again, the way T4 is converted to T3. Not only that, but if you have chronic fatigue syndrome and you have adrenal problems, the chronic fatigue and the stress response caused by the adrenal glands can also spill over and affect your sex hormones. So now you can have irregular menstrual cycle, you can have PMS symptoms, you can have depression, and all the things that go along with sex hormones. The next thing I think about is mold exposure, right? That's number 8. Number 9 are nutritional deficiencies, and number 10 are liver problems. And again, mold and the last issue that I just talked about, nutritional deficiencies, I've talked about this in past videos, done a lot of different videos. So again, if that's a topic that's of interest to you, you can always go back and watch some of my other videos on my YouTube channel. So again, liver problems is another issue. A lot of people with gut issues, a lot of people with liver issues, a lot of people with gallbladder problems. Many of these people you find are also suffering with chronic fatigue syndrome, brain fog, and chronic pain or chronic inflammation, right? So again, liver problems might be liver toxicity. It might be even a fatty liver. It might be something called Gilbert's syndrome. All things that most typical doctors overlook. All right, so there you go. We covered a lot of ground today, but just as a quick summary and reminder about today's video, if you are experiencing chronic fatigue, brain fog, chronic pain, it's worth finding out if you have this pattern or this subtype of hypothyroidism characterized by low T3 and low free T3 levels. Keep in mind, again, patients with chronic fatigue syndrome and fatigue, again, they often have this subtype of pattern of thyroid disease that begins and shows up. It often gets missed when a doctor only looks at a screening test, meaning that if your doctor only looks at a TSH test, you can miss this pattern. The next thing is if you can't find a doctor who will run these tests for you, these atypical thyroid tests, I'll leave a link in the description box along with some other very helpful links and additional readings if that's something that is important to you. And again, another important reminder is that if you do have low T3, it's not enough to take Armour. It's not enough to take Cytomel because, again, they're not going to address the root cause of the low T3. And that's really what you're after. What's the cause behind the low T3? All right, so to wrap up today's video, I hope you have a better understanding as to some of the reasons behind thyroid fatigue. But now I want to hear from you. What's been your experience with what we've talked about today? So tell me in the section below, what's been your experience with chronic fatigue and thyroid disease, right? Drop me a comment below, and if you have questions and you're a subscriber to my channel, I will do my best to answer those questions, okay? So we'll see you at the next video. Take care.